This therapeutic system is designed to counteract and remedy the negative harmful effects of the long-held static postures and repetitive strain so frequently experienced by dentists, dental assistants, hygienists, and receptionists alike. This series was developed by me based upon my years of experience as a yoga student, yoga teacher, and keen observer of expert physiotherapists in their lectures and demonstrations. The system, as you see it, was developed originally for myself, by myself, really organically over time, and grew into a system for me to treat my own myofascial and muscle knots and stiffness, together with joint strain and stiffness in my neck, shoulders, arms, wrists, and low back. This system has worked so incredibly well for me that I felt that I really needed to share it with my colleagues. I want to thank you for dropping by, and I wish each and every one of you the best of luck. Okay, I now want to introduce my assistant Terry, who's going to be learning these therapeutic movements for the first time, and hopefully able to incorporate it into her daily practice to counteract all the deleterious things that happen during dental assisting. Hey Terry, so are you game to learn some new things today?
Absolutely.
Fantastic. Okay, shall we begin?
Let's get started.
Let's get started, okay. Now we will make use of our smaller, narrower bolster, and we'll need, as you see, a yoga mat and a rolled up blanket under Terry's neck, and later we will use this dense foam block. In the first series Terry will be demonstrating, you can see the bolster is positioned horizontally across her body at the level of her sacrum. And in this point, Terry, your buttocks are just below the bolster, correct? And then can you just kind of do just a little bit of relaxed windshield wipering side to side, and maybe just let your arms come out to the sides of the mat, sort of in a really relaxed way, and you can have them a little further, okay? And just do a little gentle side to side sort of windshield wipering. So we're just kind of doing something really, really gentle, just to become comfortable and make sure that we know where that bolster is, okay? So now we're going to just get you to do a few good long inhalations and long exhalations while you're doing this. Now, can you please bring your knees up so they're stacked over your hips, right? So lift your knees up off the floor, and you can bring them together a little bit. And now you're just going to make little circles in one direction and then in the opposite direction. And we're just using the bolster now to massage the sacrum a little bit. And if you want now, you can make those circles a little bit wider, a little bit bigger, could extend the feet when we do this, and then the opposite direction. Super, okay. And then if you want, you can rest and put your feet back down on the floor briefly. Now, we're gonna bring the arms up here as if we're hugging a giant beach ball, okay? The arms up like this. We're going to now stack the knees again over the bolster, and now we're going to do a little spinal twist. So the legs will come toward me and the arms will go the opposite way as we deflate the beach ball. And then we're going to inflate the beach ball with a big breath and move the arms the other way as we deflate the beach ball, and then back. Okay, super. All right, so we're using the bolster to massage the sacrum, the rolled up blanket to massage the neck. Okay, we're going to roll the knees over this way, and the arms are going to follow them. Stretch that arm right out, and then this hand is going to follow that. We're going to come right over, and then extend the arms towards me and the legs towards me, and run that hand down all the way past this one as we come into a full extension. So we're really getting a lot of use out of this bolster, massaging these great muscles that from the hip that connect into the pelvis and we're using the full extent of the blanket to massage the neck. Can you go back to where you were? So you're going to repeat this several times when you're practicing this at home. Okay. Raise your hands up and turn them this way. Put the elbows on the floor like we're doing a stop sign, okay? And now we're just going to let these hands fall back to the floor. And if your hands don't fall back to the floor, that's fine. You may only be able to get to here. That's okay. Over time, you'll get more opening, and believe me, you will get closer and closer to the floor like Terry is. Now, can you stack your legs up to the bolster again? So now on the inhale, you're going to be here. On the exhale, I want you to bring the knees to the elbow. Right to the elbow. Good. Now, inhale back to center, and exhale back to the opposite side. So what are you doing? You're making a little smiley face with your knees, aren't you? So you're going to inhale back. As we open the chest, we inhale back. As we exhale, we squeeze the chest. So we always want to do the inhalation when we're opening the chest. If you want to work your core a little bit more, on the inhale, extend your legs right out. And now exhale, bring them all the way to that knee. Inhale, extend your legs out. Extend your legs out. Exhale, bring your knees back to this elbow. So what are we doing here? We're getting a spinal twist. We're continuing to use the bolster to massage ourselves, and we're massaging our neck on here. Okay? Alrighty. That was great, Terry. Well done. So that's a demonstration of the first position of this narrow bolster. Okay, Terry, so now we're going to have you elevate your legs straight up above your body. Right, and if you want, if it feels good, you can hold yourself there, whatever feels good for you. And the beauty of this is now you can have a leg inversion that anyone can do, because we have the bolster propping you, wedging you in this position. So if you're a yoga practitioner, you may be doing a shoulder stand or a headstand. That's pretty difficult for most people. This is really super easy. And the benefit of this, of course, is that now you're going to get beautiful venous return of blood to the heart. You're going to get the return of lymphatic fluid, all assisted by gravity. It's really giving your heart a break, which gives you a really great health benefit. So while you're here doing these exercises we were doing before to open up spaces in the sacrum, etc., why not pause here and take advantage of this super easy leg inversion to get those medical benefits. Did it feel pretty good, Terry?
Feels good.
Excellent. Okay. Okay, so Terry, now we've positioned this bolster under your spine lengthwise, hey? And you've told me that now you can feel that the end of that bolster is right on your sacrum, which we found earlier when it was crosswise. So you know where that is. And your buttocks are just barely dropping down onto the floor, correct? Good. And we have your neck supported by the rolled up blanket, and your arms are relaxed out to the side. Okay, so when we do this procedure, we're going to really be working on our breathing here, which is a huge relaxation benefit psychologically, as well as helping our physical exercise. And so the breath the exhale is going to start when Terry lifts her sacrum up, just barely lifts it up. And now the exhale is going to finish when her arms come up and her fingers come together, right? And then the inhale is going to begin from down here when she drops her sacrum. And then the inhale is going to finish here. Okay, so I want you to just slowly do that. You begin the breath here, begin the exhale here, right? Finish the exhale here. And look how her shoulders come forward here, and it helps to squeeze the air out of her chest. So drop your sacrum, begin the inhale here, drop this, see, and this really opens the chest when she does this. So there's a little wrinkle we're going to do. Terry's going to form what's called chin mudra with her fingers like this, and then she's going to begin the exhale by lifting this, and that helps to relax the diaphragm and squeeze the air out of here. Then you bring this up, and then she's going to turn her shoulder shoulders like this, and then when she brings her arms down, there's a rotation here that's going to happen as the backs of her hands come to the floor. So now that's the finish of the inhale. So the beginning of the exhale here, lift the sacrum, we squeeze the air out, we bring the arms up and turn them, bring them all the way up and turn them toward one another. Now the inhale starts here as we drop this. The lower abdomen is expanding. Now this comes here, and you see how her chest comes up, and so she has room in the upper chest for a full breath. And the exhale starts when the sacrum comes up, and we squish this, helping the diaphragm. Then this comes up, and we're going to turn this here. And I want you to see this, so just stay here for a second. See how her shoulders are now inwardly rotated. It's depressed her sternum, and this is really aiding to finish the exhale here. So then we can just start the inhale by dropping here and finish the inhale by rolling down here. Good. All right. There's one more little wrinkle to this that's really worth doing, so just relax here for a second, Terry, and you can just let it. Now we're going to bring our hands up like it's a stop sign, and we'll bring them up, see, and now we're going to drop them here, and during this sequence, Terry's arms are going to come all the way to the floor. That is going to be during the exhale, and look how it's lifted up her shoulder and it's squeezing the chest. So on the inhale now, we're going to, we've dropped this already, so that's the beginning of the inhale. Now we're going to finish the inhale by doing that. And the exhale is going to start when we lift this, compressing the lower, and then we're going to inhale here. Exhale by doing this, finishing the exhale. This should be very, very relaxed as we do it. So we drop there, inhale begins, inhale finishes here. This is a three-part breathing. In yoga, we refer to this as dirgha breathing, but anyway, that doesn't really matter. All that matters is that you learn how to do this, and we're getting some really good motion in these joints, which suffer a lot from our work. We're dealing with we're opposing our inwardly rotated shoulders. Okay, so do you want to just do that a couple more times on your own? So there's the exhale. We're going to drop there. That begins the inhale, and then lift that and begin the inhale, and then lift this. So what are we doing here? We're massaging this, we're working the shoulders, we're learning how to use our breath to relax. For our third use of the narrow bolster, we have it positioned under Terry's shoulders and at the armpit level. And you'll see that we have a rolled up blanket, and it's sitting on top of our dense foam block, so that the blanket is fully engaged in the hollow of Terry's cervical area. So we're going to take advantage of this for massaging these tissues and allowing some opening to. We're going to begin this with the buttocks staying on the floor. Now, Terry, could you bring your arms up above you and form like you're hugging a beach ball, right? So that's great. So this is the big inhalation here. And then on the exhale, Terry's going to extend her arms all the way to the other side there, bring her hand to the flat, and extend the arm with a hand way past the other hand, so she gets full use of this bolster to massage her body. Her neck has come right off the towel, and then come back to center, inflate the big beach ball on the big inhale, and then slowly exhale and extend the other way, and the palms find one another and slide across one another. Excellent. And then we're going to come back to center. Great. So you want to do that several times so that you get, the full benefit of it. And then if you don't have any serious neck issues, if you know your neck is fine, or if you've discussed this with your doctor ahead of time, and you get the okay to do this, this will give a little bit more intense massage, and for me it really produces some kind of like auto chiropractic adjustment. So for this, Terry, can you interlock your fingers, please? And now here, Terry's going to lift her buttocks right up off the mat, so she's directing all her weight into her shoulders and her neck. And now this is the big inhale. And on the exhale, that elbow is going to find the floor. And then back to center, inhale. And exhale, this elbow is going to find the floor. And so, Terry, can you feel how this is really massaging the neck and the shoulders for you?
Yeah.
Yeah. So come back to center and inhale and inflate the big beach ball. And then exhale, and we're going to find the floor on the other side. So you're going to do this as many times as you need. So, and then you can come back to center, Terry, and if you want to just let everything relax and come back down. So that was fantastic. Did that feel good?
It felt really good.
Yeah. So what I would suggest to you with all of these sequences that you've seen us doing here, you want to do them longer than what we've been demonstrating. When I use this practice at home, I do it each position lots, and I'll do each one depending on what my body's telling me. If I'm really tight in my neck and I'm getting a lot of clicking and popping somewhere, that tells me, you know what, I better keep doing this one. So I would urge you to listen to your body, tailor what we're demonstrating to your own unique situation. Okay, now we're going to enter into the final use of bolsters, and we're going to do a restorative pose for Terry. It's a relaxation thing. It's kind of a final resting pose. So as you can see, Terry's sitting facing this way, a little bit cross-legged, and she's got the bolster kind of at perpendicular to her body. So go ahead, Terry, and just lay yourself down on the bolster. See, that's all she's done. Okay? Isn't that nice? And now she's going to extend the upper leg, lower leg, and then extend the arm, and then back it off a little bit so it's comfortable. And then she's going to bring this arm behind her. And then I think, Terry, you find that your head's a little bit more comfortable when it's the other way.
Yeah. Okay,
so go ahead and do that. And this is really interesting because what we're getting here is we're getting a very relaxed way of counteracting those internally rotated shoulder problems that we all encounter. But this is in a very relaxed resting pose. So Terry's able to really access that parasympathetic slow down aspect of the autonomic nervous system. She's able to have a lovely rest here and also get some really gentle restorative opening. What I find interesting here is that Terry has her head pointed in that direction. When I do this in my own practice, I don't have that much opening and my head has to be pointed the opposite way. Terry, could you just show that? So when I do this pose, I have to be like that. And so I always find it interesting, the differences between opening that people have in various parts of their body. And maybe if Terry had practiced dentistry for 35 years like me, her neck might not be as open either. Also, when I do this pose, I use this little bolster because I find that one, because my body's different, to be quite uncomfortable. So this is the bolster of choice for me. And that's the head possession for me, but go ahead and go back to the one that you like, Terry. And that's what works for Terry. So this is a wonderful restorative pose to finish your practice with. But you should tailor it to your own body the way that Terry has here. Okay, don't fall asleep, okay? And obviously, whether it's obvious or not, Terry, can you just shift around the other way? So your legs are the opposite way? Yeah, so come up to it so you're facing the opposite way. And then she's going to lay on the bolster that way. And her opposite leg's going to be stretched. Her arm's going to come the other way. And maybe, do you feel better with your head rotated the other way, the way you did before? Does that feel good?
Yeah.
Yeah, and probably what Terry's enjoying here is a nice stretch through the neck, right, Terry?
Yeah.
Yeah, so that stretch that she's getting through the neck, is that okay if I show them where here, Terry? Right through here, right?
Yeah.
Yeah, so that stretch in the neck for me would be way too much. For her, it's just right. So this is about recognizing the unique features of your own body. Listen to your body and adjust the pose to you rather than adjusting yourself to the pose. Great work. Thanks. So here we have Terry demonstrating for us what I would like to suggest to you as an optional pose. And the reason that I say an optional pose is I know firsthand from having taught yoga that this is, for some folks, a very difficult pose. But I just find it so darn useful in my own daily practice that I wanted to make sure that we showed it to you today. So here's Terry. You're in just about the right amount of support, hey Terry?
Yeah.
Yeah. And as you've been laying in this pose, have you found that gradually your butt is dropping a bit more to the floor?
Yeah.
Yeah. So you kind of just gradually get that release, right?
Mm-hmm.
And you feel a real stretch through the quads here, hey?
Yeah.
And a little bit up through the muscles in the abdominals too, I think, hey?
Yeah.
Would you say that's mainly where you feel it?
Yeah.
Sort of from about the belly button down to about the knee, right?
That's where it is.
That's where it is, yeah. So if you've been out hiking and walking and running, boy, is this a super stretch to have. And you know what? Everything in the body is opposing muscles and opposing structures, hey? And today we've been working on other areas. The other nice thing about this is you're getting a nice little back bend.
Mm-hmm.
And this is a very easy way, because a back bend is not an easy thing for people to do. So in a minute I'm going to show you how you can do this with a whole bunch more support if necessary. You can see that I'm now in the same upward facing hero pose that we had Terry in a minute ago, and I'm using a little less support than what she was using, and that's just because I'm feeling pretty open today. But it hasn't always been this way for me. And as I stay in the pose longer, I can feel my butt finding the floor more because things are opening, they're releasing, and I get more and more opening through the quads and the abdominals. But as I say, it hasn't always been this way. It's funny that this is called upward facing hero pose because I think a lot of people who try it feel that you kind of have to be a hero to do it. So what I can tell you is that for a lot of you, you're going to be like I was when I first started trying this, and what a lot of the people that I've taught over the years are like when they first try to do this. In other words, more support like this. This is for the neck, and you can see I'm not nearly as far back as I was. And for a lot of folks, even this will be difficult. And that's okay. Just find the amount of support that you need for your body. And trust me, this is where I began, and you saw a minute ago where I am now, and these changes are gradual. But this is a great stretch for the quads and the abdominals, and I suggest it as an optional addition to everything else we've shown you today.